on this episode of A Tale of Two Hygienists.
I became super focused on maternal discomfort and how it affects maternal mental health and how pain and breastfeeding is completely brushed off. I think these families are really struggling, and we have such a profound impact on not just how feeding goes, but how they feel about their early parenthood months and years. It's bigger than just feeding a baby.
Even if we can help, so many moms just understand that this isn't normal and it's not their fault. And that this piece is really easy. Education, putting it out there, it's free. And we just want as many people to know about this as possible.
I hate when parents come in and they'll say oh, I've been told that my baby's a lazy feeder. It's kind of just that the tongue doesn't actually have the correct movement to it yet. So we have to really train how that tongue needs to engage, around a nipple to be able to draw and get that breast milk.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists podcast, episode number 421. My name is Andrew Johnston. I'm your host for this episode. Thank you so much for joining me today. And today is an interesting discussion because it's foundational to literally everything that we see and do as dental professionals. We're talking about myofunctional therapy, but with babies. This is the time that things start to really go right, or they start to really go wrong. And I'm joined today by Leslie and Heidi again. And they also brought in Paula Norcott, who works as a lactation consultant. We covered so many topics, and it was such an interesting conversation as well. We kept bouncing from one topic to the other. And because it was so good, this is one of those ones that just lasted a little bit longer than I expected it to. So we ended up breaking it up into two different episodes. So even though this was supposed to be a series in and of itself with the myofunctional, this is actually going to be a series within a series of myofunctional therapy, but with babies. So in the first episode, in this episode, we talk a lot about, I think it was this episode, about what the evaluation looks like, whether there are issues that are mechanical or anatomical, like what's causing the issues that we're seeing arise. And we talk about body work, what that means. And I think it was in part 2, and this is gonna be for next week, that we talk about some red flags for tongue ties, suck training for babies, how to evaluate and encourage proper technique, breastfeeding versus bottle feeding, and pacifier use, and so many other things that kind of came up. So we really did cover it all. I'm really excited for you all to hear this one. And because this one is a little bit more educational, one thing that we're working towards doing is bringing back our CE courses for you all. So be sure to check out the show notes in each episode for a link to take you to the test after you listen to the episodes, or maybe even before. If you are one of those people that likes to kind of know what you're getting yourself into, you can go ahead and log in and kind of see what the questions are. And that way you can listen for those answers as they come up. We added a half a credit to the episode a little while back where we talked about blood work and labs with Megan Barnett. So if you are interested, you'll have to go back, probably using the website, and find that link. One tricky thing with podcasts is if you've already downloaded the actual episode to your phone, then that link might not be there. You might have to delete it and then re-download it, or just go to the website and find it there because it's now refreshed, and that won't refresh automatically on your phone. These tests that you're gonna have to take aren't exactly the easiest, but generally I think that if you're paying attention for most of the episodes, you're gonna pass them. If you are confused on where to find the links to the tests, all you have to do is click on the title of the episode, and that'll bring up a thing that we call the show notes. And in those notes for that specific episode, there'll be a link to a thing called the Dental Academy of CE. And they're the ones who do all of the hosting and awarding credits for us on our behalf. So really thankful for them for doing that for us. In the next 10 days or so, we're going to be coming out with a new newsletter as well. It's one of my favorite ones because it's the in the news version. And I've been stashing away some really good article links for you all. And remember that the purpose of this one is to help you have conversation with your patients, but also kind of keep your own mind engaged for that work week. One of those articles is about a murder that I'm absolutely fascinated by right now. So be sure to head over to the website at taleoftwohygienists.com And when that pop-up appears, put your email address in to make sure that you're added to the list if you have not already signed up. That is all for me for this week. Thank you so much for listening. Enjoy this amazing episode, part 1, with Leslie, Heidi, and Paula.
A tale of two hygienists.
Welcome, everyone, into the interview portion of the podcast. I am joined today by Heidi, Leslie, and Paula. This is for our part 2 of our Myofunctional series. I'm very excited about this one. Heidi, this is going to be great because you're going to be kind of like co-hosting / leading this discussion. I'm very excited about that too.
Me too. I'm super excited to introduce Leslie and Paula. So Leslie is my partner in Myo2 Health, and she's really the baby expert. So I will help interview her and Paula, who work closely together. Paula is a member of the study group that we have, and I met her through that, and her and Leslie work a lot together. So yeah, I'll help with the questions today.
Thank you, Andrew. We're happy to be here.
Yeah, so glad to be here today.
Look, I don't care. We're gonna keep this part in. This is a huge edit point. I'm sorry, listeners. We had some malfunctions. We're coming. That's why Leslie's laughing right now. It's gonna be out of context, but we're just gonna go with it. We're gonna keep it going because we can't start and stop one more time.
Okay.
But I'm just so happy about this. You know, the part of the series that we're in right now is really foundational to, I think, what's coming up in the next couple episodes. And so having an expert on like the both of you, it speaks volume. So this is going to be great. So Heidi, where are we starting with our interview with them?
Just getting a little bit of background information because, to become a myofunctional therapist, we have specialized training that we go to, and it's a continuous process. But Leslie, has taken specialized training for babies. And so I really consider her and our partnership the go-to expert. And Paula, she's taken myofunctional, therapy courses as well, and really put a lot of time, both of them have, into the education and that baby component, which is absolutely amazing. So I would like for them just to kind of go into a little bit of detail what extra training they've had for babies.
Yeah, happy to. So yes, in addition to kind of the myofunctional therapy courses, I think I was really drawn to the babies just due to my own experience with nursing my daughter. And so when people talk about like myofunctional therapist and like, screening for babies, it's not really the same type of myofunctional therapy work that we do when we're actually seeing adults or even, children when the muscles are more developed. It's kind of addressing more what those muscles are doing in order to be able to suck and engage the lips properly and kind of create the tongue movement that we ideally want for the baby to really be able to draw in the milk and then have the correct swallowing pattern. So some of the trainings that I did for that was with Dr. Richard Baxter at the Tongue Tie Academy, and the way he works with babies, and that book itself, Tongue Tied, was phenomenal source of information as well. And then continued after that and did some training with Dr. Chelsea Pinto out at the Breathe Institute, and she does the Breathe Baby course. And so those two together are really what kind of started my foundation of understanding more of the connection to how important the way these muscles actually have to be used when it comes to breastfeeding or even bottle feeding. It doesn't have to be just breastfeeding. It's truly just feeding in infants. And I say that to all the moms. It's not that I'm here to push one way or the other. It's because there is such an importance to how those muscles are being used to make feeding successful. Then as I've continued to do all of this and worked with people like Paula, and we have such a close relationship, and even just learning from the collaborative care that we have with working with the IBCLCs and OTs and, even speech pathologists. But Paula has a wonderful, base of knowledge too, that she continues to keep educating me every time we work together as well. So.
Yeah, my favorite thing that I get to do is collaborative care with other professionals in this line of work, because I think so much of this is new to us, and we're kind of part of it we're learning as we go, right? Especially around infant feeding. So my background is I've been working with feeding families for about 25 years since my second baby was born. I have 5, and my second I had a lot of struggles with, and nobody could really give me any answers, and started kind of seeking it out on my own, got my international board certified lactation consultant certificate. But we barely touched on tethered oral tissues in that coursework. So a lot of the specialized education I had to seek out on my own. I think my favorite, I've got 170 continuing ed hours on tongue and lip ties and babies because I've been through it myself. And my favorite course that I took so far was the TOTS training with Autumn from Chrysalis, myofunctional therapy. We did a couple days. I actually got to laser like a pig jaw, which is really fun. I'll never touch a laser ever again, but that was a good time to really understand how it works. And I became like super focused on maternal discomfort and how it affects maternal mental health and how pain and breastfeeding is completely brushed off, how little education pediatricians and obstetricians have around breastfeeding, some of them literally none. And when you consider that the single most important thing that has to happen in an infant's life for the first 3 to 6 months is that they have to eat, it's bonkers that they don't know much about this. It's not their fault. It is just can be very frustrating for families. And so really focused on what we call low milk supply. And I say it with air quotes because it's not always what it seems. And then that pain or even worse, damage for the feeding parent is really tricky. So yeah, I can't even get enough. If there's anything out there on all of this, I want to know. I want to work with anyone who's excited about this. I think these families are really struggling, and we have such a profound impact on not just how feeding goes, but how they feel about their early parenthood, months and years. It's bigger than just feeding a baby.
How long has the lactation consultant realm been around? Because I feel like even with my wife, we had our kids 15, 17 years ago. It felt like it was like newer, but it couldn't have been newer, right? Not then.
No, I think what has happened is that it's not been prioritized for a really long time. So,
Okay.
I've worked in a hospital setting for a long time. And even when I work in a hospital that seems to really care, they still limit the hours and the budget allotted to lactation. It's just simply not prioritized. Also, the Affordable Care Act changed a lot. So with the Affordable Care Act, there's a lot more breastfeeding protection written into that. So one of the pieces was that all insurance will cover up to 6 visits with an IBCLC, including a prenatal visit, and that their breast pumps are covered. So that was a huge shift in how insurance handled a lot of lactation pieces. But it's still, I think in certain parts of the country and in we're in Maine, really rural areas, even here, just really don't have access to that type of specialized support. So it doesn't shock me that you didn't see it when you all had your babies.
So we talk about access to care quite a bit, and was something like the Affordable Care Act, does this encourage more people to embrace and reach out to get consultations done, or was it just like you kind of saw the same numbers anyway?
No, huge shift. So if
Really?
you figure a visit with me is $225 and your insurance will cover it, that's crazy. And I see this happening down the road for myofunctional therapy too. Like eventually people realize how valuable it is. But when we look at protecting the right and ability to breastfeed as like access to first foods for humans, like if you think about all the protection we put around making sure children have food because of brain development, breastfeeding should obviously be a part of that. It's a choice, and I'll never say anything different. Like it's up to each parent what they want to do. But what we need to be doing is helping the parents who have goals that they want to meet around feeding their babies with their bodies and giving them every resource that they can, because that does impact that child's, that's access to food, which is a huge issue in our country. So yeah, it's all related. Mm-hmm.
How does the prenatal appointment differ from maybe like appointment number one? And kind of how do you start talking about like myofunctional issues then? And you're like, hey, gearing you up just in case this might be a thing.
Yes. So I love doing prenatal appointments with my patients. And in the hospital, we were actually starting to do them too. I'm mostly in private practice now. But what I love about the prenatal is the most important things they're going to take away is like, what are warning signs that they need to reach out for immediately? And then the other piece that we've done is we've put them face to face with a professional who can help them that they feel comfortable with. If you wait until the postpartum period, people are so vulnerable, they're overwhelmed, they're exhausted, trying to even just look for the people to help them or even understand what it is that they need is really complicated postpartum. So if we can hit them beforehand, build a relationship, and then tell them the two most important things that I tell them is it's not supposed to hurt. And you'd be surprised at how many people think otherwise. It is absolutely not.
Well, TV would have us, all the jokes that happen, have us think other ways.
Yeah. God forbid you get in those mom Facebook groups, where they're like, oh, bleeding nipples for 2 weeks, totally normal. No, not normal, that it's not supposed to hurt. And that babies, most people, the vast majority of humans who lactate can make enough milk for their baby. And so this other piece is that they're told constantly they have low supply, you just can't make enough milk. And very often it's a mechanical issue in a baby that is actually causing a body to not get signals to increase volume. So it's because it's a dyad, they work together. What's really special about what I do is they're both my patients, not just one, not just the other, not just the baby, not just a parent. They are both my patients. I'm one of the very few, medical professionals who sees a parent and baby as a dyad, and they're both my patients.
And that is a huge component to when we look at it from the babies, is that when we address them for if there's structural concerns going on, like if, Paula's been working with a family and, she spends a lot of time with those families and working with the mom, and whether it's, putting them in different positions and seeing if changing the position that the baby's feeding in, makes a difference there, or just even the, kind of creates a plan for the family to say, like, here's how we're going to try this, do a couple of bottle feeds, then, do a breastfeed, work with the family. But then we have to look at what are the symptoms that are kind of happening for mom. Like same thing, pain is a huge one, like Paula said, and I can't emphasize that enough when moms come in and they're like, I just think it's me. I don't produce enough milk. And I say, that's not what our bodies are designed to produce the milk for our babies. And so that's more of a signaling, your baby's not creating the signal essentially for your body to start producing the milk that the baby's trying to demand. And so there's certain things like when we actually assess from a myofunctional therapy standpoint too, that we ask these questions. They come in, they fill out a form. And so they're filling out, what the mother is experiencing as far as if they've had a lot of damage to their nipples. Again, there shouldn't be that pain and damage to the nipples. So if they have the blistered, creased nipples, bleeding nipples, and Paula, you can chime in here too, but there's the, pain upon latching, the pain continuing as they're nursing. What else do we ask about? The supply, if the baby prefers a preference to one side over the other. So there's things that we ask about the mom, but then also like with the baby too, there's a lot of symptoms that I think we don't really know. And I say that from my own experience of, being a first time mom nursing too. Like, you just kind of think like we're supposed to know how to do this. I'm supposed to know how to nurse my baby. My baby's supposed to latch, and this is just what it is. But when your baby has a shallow latch or just is popping on and off your breast and not able to maintain that latch, or has a strong gag reflex, is spitting up after every feed and, acting gassy and refluxy, has hiccups after every feed. There's this list of things that really we don't want to be the cycle that, moms and dads are having to deal with feeding. And so when we start to dive into that a little bit more about what those symptoms are and what it actually looks like inside the baby's mouth in correlation with, what's happening from mom and her breast and things like that too, they're really important pieces to be looking at all together.
And I just think this is so important, having struggled with, breastfeeding myself, there's such guilt we feel as moms because we, especially when you're a first time mom and you're not knowing any different, like, what am I doing wrong? Like, why is my body doing? And I think it's such a mental health component to it. And so I just think that this is why this piece of this is so important. Andrew, I appreciate you giving us this platform, because even if we can help so many moms just understand that this isn't normal and it's not their fault, and that this piece is really easy. Education, putting it out there, it's free. And like, we just want as many people to know about this as possible.
How many of the symptoms that you listed, Leslie, and maybe Paula can answer this as well, how much of this is anatomical versus like a mechanical issue? Like it's just like wrong positioning or, just maybe not just getting the mouth and all the things to do, be positioned properly, as opposed to like having a shallow palate or, something else?
That's a great question. I think, and Paula, let's talk about this together, because I think it's actually a lot of times both. And that is where, working with someone like Paula, beforehand, so that you are starting to address some of those things first before it comes to actually like, do we need to be assessing anatomy, is really important. So a lot of times if my patients say they're just coming in because they've been told or just think themselves that they have a tongue tie, and that's not even the sole reason too. Like, again, when they come in, and we'll talk about that a little bit more, but what we're doing for an exam, but say they've been just told by somebody and they haven't worked with lactation yet, or even looked at like body work. I kind of always listen to the actual labor and delivery story. Like if there's been a really long labor where that baby has been in the canal for a long period of time, or even a very quick labor or cord wrapped around the neck, there's a lot of things that impact this. And so when you listen to that story, you kind of have to start piecing some of these things together. But if they haven't seen somebody like Paula yet, I will always kind of guide them in that direction, so that we are looking at, okay, well, how much of this is just kind of like, again, we think we're supposed to know how to just magically put our child to breast and breastfeed, but it doesn't always happen like that. So having an expert like Paula to be able to say, okay, this is kind of how, we do want to see it, and let's see if we can work towards having that happen, is kind of the first step towards things before we even then say, okay, let's now start questioning anatomy.
Yeah. The very first question on my intake form after the basics is, tell me about the birth. And what I want to know. So I was also a labor doula for a really long time. I've been to 250 births. I worked in labor and delivery. So I know all the pieces. So long pushing phase, short pushing phase, cesarean delivery. So anything like over an hour and a half or less than like 45 minutes, we consider in those long and short multiples, because they're so squashed in utero and they're, getting lots of compression, forceps delivery, vacuum delivery. So those to me are we're always going to start with body work, because what we see is that sometimes just that tightness, we have these babies whose shoulders are touching their ears, and they're, we hear that they're very strong, and really what they are is very tight. It can mimic what are actually, true tongue tie symptoms. So we want to understand what the birth looked like and what any time has looked like since then. Have they had any body work done? And let's start there, because if we can fix these problems with body work, that is what we want to do.
Yes. So often Paula and I are like, well, we're going to go see body work first before we go to this. And it's so crucial. And some people, I think some of the parents look at me like I'm crazy when I tell them that part of it. But like Paula just kind of explained, is that it is such an essential piece to the picture. And when you've seen as many babies as, Paula, much more than I have, but seen even as many babies as we have together too, I can't speak to enough of how much body work actually helps, parents when they go through something like this.
Yeah. Do you all mind? Maybe I just missed it. Explain body work a little bit more for our audience. I think that they were like, oh, great, body work. Go and get the fender,
go get a
pounded out.
Totally. Yeah. So I have a funny story about body work, because I'm from Boston and I'm also a Gen Xer. So I am a very skeptical human being who trusts nobody, right? So we actually in Maine here, we're in a pretty unique position, because we have our medical school in our state is actually an osteopathic medical school. So the vast majority, and a lot of them stay and they do residency here. So we are really it's kind of special here. We're in our hospitals, in our actual labor and delivery units, in many of our hospitals in the state, we actually have DOs who round. So those are osteopathic doctors who round on our entire hospital and will do what we call OMM or OMT. OMT is osteopathic. They're the same thing. It's just one certified and one isn't. But it's very gentle, like craniosacral therapy type touch, where you watch them and you think, what are they even doing?
Mm-hmm. We call it voodoo. We're kind of like, sometimes we're not quite sure what's happening, but it's magical.
My initial response was like, what is this nonsense? And then what I saw very quickly was these unbelievable transformations in babies when this osteopathic doctor just sat with them on their hands. You can literally watch these babies like unfurl. And I could tell you stories for days about babies who had been screaming for hours and nothing we did stopped. osteopath comes in and it shuts them off like a light switch, and then they feed beautifully. So we were actually doing a study in the hospital I worked in just before COVID happened on how bodywork impacts breastfeeding difficulty, but COVID ruined it, just like it ruined everything else. So, but it is amazing. And I would say, so we craniosacral therapists, osteopathic doctors, certain chiropractors who have specialized training in infants. And what I tell people is you want someone who works on infants all the time. You don't want someone who says something like, oh, I could treat a baby. No, no, no. They need to be treating babies daily and really understand the fascia and the mechanics of the fascia and how it all works together. And we have a great, Maine is very special where we have got this just really great group here. I think in other states it's trickier, but it's starting to happen more and more that all these people who want families to be successful are coming together and referring to each other so that families get everything they need. So it's kind of like a baby massage, but even less movement. They love it.
Well, an important part to that I was kind of taught by some of the osteopaths that we do work with is that in the back of our neck is where all those cranial nerves are housed. So when babies are, with the delivery story or even just how they are in utero for long periods of time, is that there is this tension. Sometimes there's the kink in the neck and things like that. And that can impact the neural messages that are being sent through those cranial nerves. And so when we look at like tongue ties, and if that's actually something that's impacting the feeding, when we see a lower tongue tone in a baby, we also have to make sure that it's not just cranial kind of impingement there, not allowing those messages to be sent to kind of the nerve that innervates the tongue to make sure that the tongue can actually do the correct movement. And so that's important. Like when we do our assessments on things, that's why one of the first things that I do is, kind of feel like, is there tension? And I'm not a specialist in that area, but I just kind of make sure that the baby's head can go evenly side to side. And not feeling like it really resists one way over the other. And then as soon as we kind of work on like the sucking, I want to feel that a baby can actually engage in that suck around my finger. If a baby's tongue is just kind of, and I hate when parents come in and they'll say like, oh, I've been told that my baby's a lazy feeder. It's kind of just that the tongue doesn't actually have the correct movement to it yet. So we have to really train how that tongue needs to engage, around a nipple to be able to draw and get that breast milk.
Lazy eaters is one of the most frustrating phrases for me because babies have to eat to live. And very often it's absolutely not laziness. It's that they don't have the function. And what happens with these babies is they're working so hard to eat that they literally wear themselves out super fast. So they fall asleep constantly when they're eating, or they eat 22 times a day instead of 10, or they're feeding for hour-long sessions. They get labeled as lazy eaters. And what it really is they are working so hard, it's wearing them out and sometimes even burning calories that, proper tongue function would not burn.
Right. Because that's when there's a lot of extra muscles kind of being used, essentially. Like those are the babies that we call kind of the chompers. Like we'll see the jaw movement constantly happening with the feeding. And so they're having to work, and you can see it, the tension in their shoulders, like all these other things that they're having to work so hard to engage the kind of different muscles that need to be used because the tongue isn't doing the job that we really need it to do. And so then they're working so hard, they're burning some of these calories, and the body's just going to be like, nope, I'm just going to go back into, resting so I can conserve some of that energy.
Mm-hmm. My daughter was that lazy eater, and it was awesome in the sense that I thought she just wanted to, like the minute I got home, she wanted to nurse and just be on me all night long. And if I tried to do something else, she'd, start crying and be so upset. And I was like, oh, she just wants to keep nursing, but she'd fall asleep, and then wake up. And, again, I think just parents knowing this is so impactful.
We don't give great education around infant feeding at all. I mean, and what you said earlier, Heidi, about how the guilt, like parenting guilt, that's the hardest part of parenting. And it starts from pregnancy. But then also all of these problems are very often blamed on the feeding parent, right? So, oh, you must not be latching right. My experience is that my families who have, especially the ones who truly have tethered oral tissue that needs to be addressed, have watched every latching YouTube available to mankind. They have the best technique because they think it's them and they're told it's them, and the most common phrase I hear when I help people figure out the answers is, I'm just so glad. I thought I was crazy. Thank you for telling me that I'm not crazy, that there is a problem here. And parents need to trust their instincts a little bit more, but also understand that they're not expected to already know all of the pieces. And it doesn't matter if it's like my biggest struggles were with my 5th baby. I breastfed all of them. He was the one that was the hardest. I was already a lactation consultant. Like, I should know everything, except this one threw me for a loop, and like, we couldn't get it right. I had miserable pain. I actually, when the first time he saw a myofunctional therapist, he was 08. And she said to me, how did you breastfeed that baby with that palate? That's a really good question. It hurt real bad.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.